atelectasis, and that would be consistent here. So it seems clear that he's developing atelectasis postoperatively. Breath sounds are decreased in the bases, so that goes along with it as well. The end tidal CO2 is 35, which is reasonable, and the SpO2 is 89%, not so hot. Ventilation parameters are as follows. The tidal volume is 600, that's reasonable for somebody 75 kilograms. The set rate is 12, also reasonable. Total rate of 16, so they are taking a few extra breaths on their own, so that means they're breathing spontaneously, that's good. The FiO2 is 80%, that's pretty high, so if it turned out we needed more oxygen for some reason, we would rather not turn up that high FiO2, instead you would turn up the P, which is only single digits here, you got room to raise that. Okay, you're just never sure what direction they might be going, and so we just try to consider all the possibilities. Now the question here is simply wants to know, what are you going to recommend for this patient? Well, basically what you have is a post-op patient who's developed atelectasis, so what are we going to do to help that? A says we can increase the tidal volume to 750. Well, sometimes bigger volumes can help recruit alveoli, but that also raises pressure when we don't really need to do that here. That's not the best option. Increasing the FiO2 to 100%, well, again, that addresses oxygenation. We have a problem here with ventilation, specifically atelectasis, and we need some way to recruit these alveoli, and that's what letter C says. Let's perform an alveolar recruitment maneuver, whatever that may be. There's different types, but that's specifically what you're trying to